Hello, and thank you for joining us tonight for our free webinar, Herbal Strategies for COVID-19 and What to Do Before, During, and After Using Classical Formulas, featuring Dr. Huabing Wen. My name is Jeff Bloom, Education Marketing Manager here at L.A.C. OMS. For over 40 years, L.A.C. OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate to the webinar room. We do recommend viewing the webinar in Chrome, Firefox, or Safari, as you can experience slowness in other browsers. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of the guest speaker, please make sure to use the Questions tab to assure that we see it at the end during Q&A. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand, as well as the complimentary slides. You may always visit our blog and use the free webinar tag to find our previously recorded events. From sports acupuncture to Chinese herbs to practice management, you will find something interesting for every practitioner on the L.A.C. OMS blog. I would also like to mention a few new great features at L.A.C. OMS. We just launched our L.A.C. Direct Dispensary program to allow practitioners to recommend products to patients and receive a commission on those purchases. We will share a link in the chat to our blog where you can learn more on how to access this program using your current L.A.C. OMS account. We also now have the ability to receive text alerts about inventory updates and other important information. All you need to do is text the word supply, SUPPLY, to the number 855-358-3253, and we'll put that into the chat for you as well. For our featured speaker, we are proud to introduce Dr. Wen. Dr. Wen has been practicing for over 30 years, specializing in internal medicine, fertility, and oncology. Dr. Wen graduated with the highest honors from Beijing University of Chinese Medicine in 1987 and served as resident emergency room physician and attending physician at Dongzhi Men Hospital, where he taught and conducted research projects measuring the effectiveness of herbs and acupuncture on diabetes, heart disease, stroke, kidney disease, and thyroid conditions. Been teaching Chinese medicine in the United States since 1995 and continues to advocate for an integrative approach to all of his students and patients. Please join me in welcoming Dr. Wen.
Thank you, Jeff, for the introduction. Hi, everybody. Welcome to the webinar. This is a very crucial period. Everybody, every day, that's what you hear on the news, and COVID-19 this, COVID-19 that. And so there's also a lot of talks. Some of my colleagues and friends, they're giving talks. And one area that I found is very lack of topic. Don't talk more about that, because right now we have about 1.5 million patients. So when they recover, and some of them will have a condition called post-viral syndrome. And if they're in the ICUs, they'll have another syndrome, post-viral syndrome. And so how to use TCM, and to be more precise, how to use integrative medicine model to analyze, to treat those patients. So that will be actually increasing number of patients, in your practice very, very soon. Because from what we have learned, from all the research by far, and so COVID-19 is pretty much like multi-organ targeted, and not just the lung, the heart, the brain, the kidney, and the skin. So there's so many, still some questions, not being able to answer, from the study. But from the integrative model, if we combine Chinese medicine, with the conventional medicine, so we pretty much have much better assessment, what's going on and how to address this. And personally speaking, I like the color formulas, and so I'll try to emphasize mostly on that part, yeah, and to see what we can do, about those cases. And so there's we'll talk about the immune system from the integrative medicine perspective, and we'll talk about the herbal strategies to enhance the system. Yeah. And there will be treatment strategies for patients with the COVID-19, and a little bit early stage, the mild cases, the moderate cases, and the severe, and also the most severe, the critical ill case, that probably you're not going to see in your practice, but that fall into the category, the post-viral syndrome part. That when they come out of those SAUs, when they come out of the severe stage, they all have some lingering problems that needs to be addressed. Yeah, so that you probably will be able to help them, with the combined conventional medicine and TCM. So the post-infectious, strategies, that mostly, the shen disturbance, yeah, that is always, some area, we don't pay enough attention. Yeah, we don't always stress enough, because, talking about immune system, one of the big trigger, to kill your immune system is the negative emotional distress. Yeah, so. And right now, the fear, the frustration, the anger, all that, yeah, and because of the emotional distress, and people cannot sleep, and that will further damage the immune system more, and it's a vicious cycle. So how to address the shen disturbance, yeah, and as well as the lung, the heart, the liver, and kidney damage. Yeah, so that's and the last part we'll talk about a little bit those antiviral herbs. Yeah, even though some of you already have, the formulas, yeah, that have been used in China, Lianhua Qingwen Ying, and some others, Shuanghuanglian capsules, and some of my colleagues recommend those use. And so I'll briefly talk about how to choose from among those different ones. Yeah, what is the strategy behind it? So the immune system, we talk about it from the integrative medicine perspective. So what, normally we always say, to strengthen your immune system, that actually is a very small part of it. And you look at immune system, actually it's very similar to the TCM model, yin and yang. We're talking about the yin-yang theory. We're talking about like a qi and the blood theory. So that actually you can see almost like a mirrored reflection in the immune system. So we're talking about the yin and the yang, the coexistence, they help each other. And it's pretty much like, you have the T lymph cell versus the B lymph cell. They should be together. They should work together. So I'll probably, give you an idea. It's not like how to strengthen or how to tonify the immune system only if you have an immune deficiency. And also, even if you have an immune deficiency, if possible, we need to know which part of the immune system is deficient. Is your T cell system or your B cell system? So, or you don't have enough CD. There's so many things in the immune system. So, if you have a strong immune system, you tend to have probably allergic reaction. So you don't want to strengthen the immune system. You actually want to cool it down. If you have a weak immune system, you want to boost it. So we need to get the immune system working for you at the right level. Yeah. So not too much, not too little. So that's the reason why even though we see it, it's like, this is some language, the patient can easily understand, to strengthen your immune system. But for us practitioners, we need to know actually, if I give the patient a Astragalus, what exactly the Huangqi exactly that does to the patient, and if the patient really needs that. So there's different theories behind it, but in TCM, I like the constitution theory, so like if you tend to have a qi deficiency constitution or yang deficiency type of constitution, you need the immune boosting. If you have heat toxin or damp, you probably not need any of those tonics. What you need is like to detox, to basically boost your immune system, make the immune system more balanced and better working for you. So this is the review. When you're talking about the immune system, and if you already know this, so this is just a little bit of review. If it's a little bit, I try to use the integrated medicine model, try to see, okay, for example, like under the acquired immunity, we have the T cell immunity, we have the B cell, and there's the innate, which is basically what we're talking about, your kidney essence. We inherit our kidney essence from our parents and from our ancestors. That is the natural barrier to fight. And speaking of that, the physical barrier part, we're talking about the biggest is skin, right? So from T-cell perspective, what is skin? It's a 太阳 issue, right? It's a lung issue. If you have problems showing on the skin, so you need to go to, if you use the Shang Han Lun model, that will be the 太阳病 category, right? If you use the 脏腑, you cannot leave the lung out. So that's pretty much, so here's the overview of that. And in general, the immune response, so this is like the correct term we use. An immune response generally divided into innate and adaptive immunity. So the innate immunity occurs immediately, when circulating innate cells recognize the problem. Virus, that's definitely one of those problems that the body can naturally recognize. And adaptive immunity occurs later. So I said, relies on the coordination and the expansion of specific adaptive immune cells. So this is, again, we're talking about the yin and the yang, the qi and the blood balance. So you cannot just focus on one part, you need to focus on both. And besides that, there's another important concept, the immune memory. So that follows the adaptive response, and when mature adaptive cells, highly specific to the original pathogen, are retained for the later use. So they remember what happened next time when the same virus attacks the body. They'll set off the reaction right away, so they don't need to waste any time. And so the innate immunity, that basically we're talking about the T cell, the receptors, and so that they're not what they are looked at. They're general. They're not specific enough. So when you want to target a specific virus, a specific type of pathogen, so that you rely on the adaptive, immunity. And so we talk about the general innate, immune cells. So that we're talking about, the white blood cells, and in that, and also the type of the lymph cells. And so the reason, if possible, we need to see this is like in practice. There's especially like in the ER, people come in with a fever, and so you just run a CBC, check it out. If you see the white blood cells decreases and the number of the lymph cells decreases, and they have a high fever, they have all the tip of sore throat, all that, so you probably see this is a viral, because that is a very clear, like a viral infection signs. Virus cells, because the body uses a lot of white blood cells and lymph cells to kill the viruses. So that's why the number is going down. And on the other side is when you have a bacterial infection. So the white blood cells and even the lymph cells will go up. So this is kind of like, because in this time around, people always talk about, the PCR test is negative. This is, they tried twice, tried 3 times, it's negative, but they do have all the symptoms. And so this is kind of like in practice, and there's use all the diagnosis. You're talking about all the criteria. Now should be comprehensive. You have the symptoms, the clinical presentation, manifestation. You have any like imaging test, blood work, lab work, and so those should go together. So that's if the PCR test negative, but they have the symptoms, especially like chest tightness, trouble breathing, they have fever, or they have the GI issues. So they have definitely they being exposed to the virus possibly, and some other patient, and even though the PCR is negative, you probably treat like, So this is one area, and so we can, if just patient come to see you, and sometimes if their lab tests are available, and this is something you need to remember. The adaptive immunity, so basically the two important ones, the B cell and T cell. And so what I want you to know is basically according to the integrative medicine model, T cells is like yang qi, and the B cell is like the yin and the blood, or essence. So essence can be both, because essence can turn into yang and the qi as well as yin and the blood. So the concept is like, the reason you may ask why we treat it that way in TSM, and so the idea is the yang and the qi, they keep any tissue, cell, organ in shape. So they kind of like they focus more on the function perspective of a tissue, organ, or system, and the yin and the blood, so they're more on the material perspective. So they help to generate tissue, to generate cells, to generate the organ or regeneration, after damage, to regenerate. That actually is very similar to the concept of T cell, the T lymph cell, and the B lymph cell. And what happens normally, under the T cell system, there's one very important called the natural killer cell, NK cell. So if you treating cancer patients, so you probably hear that a lot, because their natural killer cell should be at least at a certain level, to keep the cancer cells at the bay. If that is reduced a big amount, and they'll be in trouble. By the same token, actually to take care of viruses, the T cell, especially the natural killer cell, is still the very important force, to do that job. And all the strong qi tonics, like later we'll talk more about it, Huang qi, astragalus, that all the studies are showing is that Huang qi can increase the action of the natural killer cell. So that's why this time around, you're talking about to boost the immunity. And so one thing you shouldn't miss is astragalus, Huang qi. So there's basically a little bit more details how those two, the B cell and T cell system work together. This is we're talking about the yin and the yang should be in harmony. Qi and the blood should be harmonized. So you cannot have one too much over the other one. Because also in TSM, the concept is if you have too much qi, that turn into fire. Excessive qi turn into fire. Or turn into stagnation. So that actually you look at it from the immunology is if you have too much of the natural killer cell, too much T cells, so they tend to create, they tend to go out and enemy. So that as a result, what happens is inflammation or infection. So you see more of it. So that's one side of the story. The other side, we're talking about the B cells. When you have too much of it, because they produce a lot of antibodies. And in practice, everybody knows, we have a concept called pattern, called the yin deficiency with deficient fire. So yin deficiency with the deficient fire, basically it's like the body produces too much antibody and the CD. So they accumulate, they become like irritant. So the irritant, they irritate the system, so they create like inflammation like. So that's what we're talking about, like the yin deficiency with the internal fire. So the treatment we use to to basically nourish the yin, to cool the heat, to drain the fire, that actually the focus you work on the B cell system. So those things are actually, what we use in TSM language. You know how that works. But we're in this healthcare, field. We need to communicate with other healthcare professionals, and if we can have a common language, the common language is conventional medicine. So that will make it easier to communicate. So that's and so to continue with the B cell, T cell. So there is and the immune memory. So this is one important concept. Because we're talking about like allergies, and allergies, we always say, oh, you need to have allergens. But when you have any allergic reaction, remember that is the second time you're in contact with those allergens. The first time the body may not respond, but the body create that memory, the immune memory. So next time when the same allergens show up, they go full force to attack it. But unfortunately, that can be overwhelming response. That's what allergy is about. And why elderly, they don't have a very severe allergic reaction is because their immune system is at a weaker level. So they recognize the respond, but they cannot be as strong as compared to young people. So that's something. It's like, okay, it's not your immune system is the stronger the better. No, that is not true. That is a misconception. So vaccine, so this is like everybody is waiting for this. Basically that is an induced immune response. You produce, basically the body will produce antibodies and create that immune memory, and so that will be able to fight off so the infection. So this is this you don't hear much. Everybody right now is just talking about so it's promising. When we get how fast we can get it, how soon we can use it, and just from the past history, and so you have to be very careful about how to produce, how to make it, how to test it. So because otherwise there is a condition called antibody dependent enhancement. So that is actually after the use of the vaccine, that could make the viral infection worse. So that if you're interested, that is one, a separate topic. And so just give you the idea is that vaccination, can be a very complicated issue. So it's not just as simple as, oh, we have it, we use it, fine. It may not be like that. So if the patient have those ADE reaction, and so you at least so that actually is very similar concept like we mentioned earlier. In TSM, you have too much yang and the qi that turn into fire. Actually triggers a reaction, like immune response, inflammation, and sometimes it's like even like infection. So here, it's just like a chart you look at. This is typical the immune system, right? From the up, the tonsils, the lymphatic vessel, the thymus and the lymph nodes, spleen, lymphatic vessels again, and the bone marrow, even appendix. So those are all what we call immune system. So you look at it from TSM perspective. There's what? Upper, middle, lower jiao. So because all over. So anything you see is upper, middle, lower jiao. So that pretty much fall into Shang Han Lun Shaoyang Bing. So Shaoyang Bing, that we have the Sanjiao, the triple burner system, which is the equivalent of the lymph system, and partially the immune system, and as well as right now the most the fascia system. the newly discovered, so that covers the whole body, all the connective tissues connected through this. Those are all under 少阳病. So gallbladder and the 三焦. So the other part, the bone marrow, so we relate to about kidney. So you have like basically the 少阳, the kidney, and the spleen, and the chest, thymus. Actually, it's the concept in Chinese medicine we call 中气, right? The chest qi, 中气. So that's actually right behind the sternum. So that is all the, because this one is very important, and because we talked about the T lymph cells, how many T lymph cells can the body make? That depends on your thymus function. So when we get older, the thymus function basically decreases a great deal, and especially for men. So they go way decrease way faster than women. So that a few years back, there's a study actually like showing actually answers the question. Because in cancer research, there's always, you can see the gender difference. So there's always more men and older people who get cancer than female younger. So that is even one of the actually the explanation is that because for men, the thymus function, so the thymus deteriorate early with aging process, and so they have compared to to the female counterpart. So that's one of the things that so like, okay, how do we look at it from the T-cell perspective? So this is like the immune system. Give you the idea what is that? Righteous qi versus evil qi. So the evil qi can be bacteria, virus, fungus, toxin, pollution, and the parasites. So they all target the immune system. So what is the immune system? Righteous qi, right? The other is all called the evil qi. And so this is actually showing the immune system. The correct way to say it is, should it be a balanced immune system, not too strong, not too weak. Because if it's too weak, what happens? You tend to have infection, you tend to develop cancer. But if it's too strong, that could be allergic reaction and also autoimmune disease. Which we all know, the autoimmune disease is a big problem, in modern society. So things like everything, the body have trouble to recognize pathogen, within. So they mistake their own tissue or own cells as enemy. So in short, what is that? It's basically your immune system is confused, right? So confused, they're not in balance. And so we use the same model in TCM, is yin and yang imbalance, qi and blood disorder. So that to look at the autoimmune disease. And so this showing, looks like, right, the T cell, the natural killer cell, T cells, and the B cell, T cell, yin within yang, yang within yin, right? The qi and the blood, the yin and the yin, yang, so their coexistence, the codependency. So you cannot just focus on one without the other. You have to make sure the balance. The balance is more important. Okay, so the next, we talk about the herbal strategies to enhance immune system. Like we mentioned, that's to tonify. This is just a small part of it. So the two aspects, righteous qi versus the evil qi. And so you can be working, the righteous qi in TCM. So that is, the yin perspective, blood and yin, the yang perspective, qi and the yang. So again, we talked about earlier, look at the yang perspective, the yang and the qi, like the T cell system. Like the blood and the yin perspective look like the B cell system. So yang and the qi generate the shape, keep the shape of the organ. Yin and the blood tonify, nourishing, and to basically form the shape. yeah, of the tissue, of the organ, of the system. So that concept is very, very important. And so we'll use the example of the qi efficiency part, yeah. And so that is the general. This is actually most times when we're talking about immune deficiency, yeah, poor immunity, yeah. This is the, and also the qi probably relate to more of the T cells. Yeah. And so we have we can start with the Huang qi, yeah, astragalus, like I mentioned, very focused, yeah, targeted, you know, to the T cells, the natural killer cells, and the T helper cells, yeah. So that is this is the SWAT team. You know, they go out to find those pathogens, bacteria, virus, mostly virus, yeah, kill them, yeah. So that's their job. So we can use different 玉屏风散, yeah, some of yours a lot. If that is nutritive qi this is defensive qi deficiency, so-called weak qi deficiency, and so that also relates to the lung. And you can also use the 不容易qi汤. Yeah, so that is we're talking about the spleen, the middle jiao qi deficiency. Yeah, so that also relate to the balance between the sympathetic nerve and parasympathetic nerve, because 不中医qi汤 also used to treat hypotension, low blood pressure. So you know anything, what we know in sympathetic nerve perspective. So if the sympathetic nerve is excited, so your blood pressure will go up, heart rate will go faster, right? Yeah, you get that. So that is actually what 补中益气汤 can do to strengthen the sympathetic nerve. Yeah, blood pressure, raise up heartbeat. Yeah, so that to be able to increase the circulation. Yeah, so that's part of that. Yeah. And also you can use the general 四君子汤 for gentlemen. That's the foundation formula for qi deficiency. And so this time around with the COVID-19, because some patients, you know, they show it's GI presentation, yes, abdominal loose stools, diarrhea, you know, abdominal pain or discomfort, yeah, nausea, vomiting. And so if they just showing the basic, yeah, like loose stools, fatigue, like more like qi deficiency, you can start with for gentlemen. Yeah, it's very very basic stuff. Yeah, if they get there's more issues later, we'll talk about the formula called 藿香正气散. So that is more used, you know, for the stomach flu, you know, that food poisoning. So you have nausea, vomiting, diarrhea, abdominal pain. You know, you have to kind of like basically the whole picture. You know, that we can use something stronger. And again, you know, this is actually in TSM. Yeah, it's not like one pattern. We only have like one particular approach. Under one pattern, if possible, you try to identify the sub-patterns. Yeah, so it's like, okay, there's a mild qi deficiency, a moderate or severe qi deficiency, and also if the qi deficiency is only the spleen or the lung is involved or the kidney is involved, you can choose and pick different ones. Yeah, so that is the idea. So sometimes you see the qi and the blood deficiency combination. Yeah, for example, like under chemo treatment, yeah, cancer cells. Oh, they're fatigued, they're tired, and their white blood cell, red blood cell, platelets, you know, they're like all going down. So they may more likely showing to have a qi and the blood deficiency combination. So with that, so we have Bajentang, the 8 treasure, yeah, 4 gentlemen plus 4 substance you can use for that, and the Gui Tang, you know, the basically we joke about this is student formula, yeah. A lot of the people with anxiety and heart blood deficiency, spleen qi deficiency can benefit from this one. Yeah, a lot of shen issues. Yeah, so you can move up from Bajentang to Gui Tang. So if there's more qi deficiency in the lungs, yeah, we can use like a 补肺汤, in which you know Huang qi is also the king herb, and the 人参葛散 is lung and kidney qi and yang deficiency part. So if you bring the kidney, so basically you have something with the adrenal fatigue. Yeah, so that is another part of it. If there's more blood deficiency, we can use the shen yu tang. Yeah, basically it's 4 substance, you know, plus Huang qi and the 人参. Yeah, so that's like a tonify qi, nourish blood, move blood. And there's, if the blood deficiency, mostly liver and the heart, yeah, trouble sleeping, trouble staying asleep, and that, yeah, we use 酸枣仁汤. Yeah, so those are, as long as, yeah, fall into that qi and blood tonic, so you know, they actually have immune boosting effect. Yeah, so that's we just need to identify the pattern. Right? So when it comes to yin deficiency, yeah, so this is the start of kidney and liver yin deficiency. That's the most important, right? Yeah, and so the formulas that are both, yeah, is 6味地黄丸. Yeah, this is a liver kidney yin deficiency with a little bit deficient heat. Yeah, so we talked about the concept that when you have the yin deficiency with deficient fire, you know, that is when your B lymph cell is too excited. Yeah, so they're kind of like overreacting. So they produce way more antibodies than needed. Yeah, so that's you know, sometimes we say the body is very smart. Other times it's not so smart. Yeah, so it's you may see, you know, they have a mechanism, you know, they want to produce, yeah, the adequate amount, yeah, but they somehow that the brake mechanism is not working well, you know, that's they end up with producing more. So from the 6味地黄丸, we can move up to 知白地黄. Yeah, if there's more deficient fire, yeah, you can use for that. You can move up to 左归营 and 左归丸. If there's more what we call original yin, meaning like a bone marrow deficiency. You know, the bone marrow is being suppressed. Yeah, so they have trouble to produce, yeah, white blood cell, red blood cell, platelet. Yeah, so this is something you can use, yeah, after. So the yang deficiency perspective. Yeah, so we talk about, besides the immune, the T cell system, and there's also the adrenal fatigue part. Yeah, because eventually, you know, people always say it's like, okay, after the infection, later we'll talk about, yeah, so the post-viral syndrome, you know, fatigue can be a very, very common, long-lasting symptoms left over. Yeah. So we can use 金匮肾气丸. Yeah, we can use 牛车肾气丸, which is also modified from 金匮肾气丸, the classic formula. 金匮肾气丸 is very good, is because it's not just for the kidney yang, it also helps the kidney yin. So that is like when we're talking about the water-fire balance, and 金匮肾气丸 is the one that well balanced. Yeah. So there's other, you know, yang tonics like 右归营, 右归丸. So they're more for the yang perspective. Yeah, don't have much of the yin tonics to balance it. Yeah, so if you can always start with like 金匮肾气丸. Yeah. If there's more specific, we have used 理中丸. Yeah, there's GI, you know, spleen stomach yang deficiency, and we can use the 父子理中丸. So if there's a spleen and the kidney, yeah, yang involved, and we can also use 正武汤. So the formula 正武汤I like a lot is because this is the one that when we're talking about adrenal fatigue, we're talking about the people with hypothyroidism. Yeah. And so 正武汤is the one, yeah, because this is also when we get the older, you know, the aging process, especially for men, you know, that eventually what happens is the testosterone level drop, yeah, so that you'll show more of the yang deficiency, the typical yang deficiency with the water retention. So what is water retention? So there's not enough power, you know, to process the fluid, yeah, period. So you tend to have issues with edema, issues with digestive problems, and even heart, lung, you know, that. So 正武汤 is one of the formulas I like very much, yeah, because that pretty much, you know, cover a lot of major organ system. So we have you know, the commonly used 玉屏风散 we talked about, yeah, and the 人参败毒散 is another one that can be helped this is a lot of condition. We're talking about the viral infection. This formula, a lot of people don't know how to use it. So in short, you think about like long-term chronic viral infection. Yeah, 人参败毒散 is definitely underused. This is a very good formula. They're not harsh. Yeah, they work for multiple organ system. Yeah, 人参败毒散, and 生脉散. Yeah, so this is another one for the heart. Yeah, so when we talking about damage, qi and yin, like COVID-19, that will affecting. Yeah, so the heart. Yeah, so eventually what happens, the heart qi is basically the heart muscle, and the heart yin is the lining. Yeah, so when you have the infection, post-viral infection that we know to affect the heart, that eventually what happens is the lining become like thicker. Yeah, and stagnation, not enough like flexibility, not enough movement. Yeah, and so you have the 生脉散. Yeah, that we use for that purpose. And also in practice, in the 生脉散is a great formula for high altitude sickness. Yeah, so you think about it, like why this one can help high altitude sickness is because helps the heart to strengthen the heart, in terms of both the heart cell and the lining. So 麻黄附子泻心汤. So that is when you have 太阳 and the 少阴, and the adrenal fatigue plus lung deficiency. Yeah, when you have that, you may use this. And the 金黄败毒散. So this is being used a lot. Actually, this is like the herbal anti-influenza formula. So if you're not, which is very similar to 人参败毒散. Yeah, so this time around, that we use. So besides that, if there's evil qi in TSM, what do we do? The 6 evil qi, if there's a seasonal, 6 evil qi and seasonal, you have the treatment accordingly, different strategy, right? And the emotions we mentioned earlier, this is keep the emotion stable, right? So that will good for your qi, righteous qi. That's part of the reason why your immune system become weaker or weakened, because the emotional change. Others, injuries, the trauma, parasites, toxins. Yeah. So this actually is give you the ideas, like besides all the tonics we mentioned earlier. So sometimes the best way to strengthen your immune system, to balance your immune system, is to take care the circulation, get rid of the parasites and the detox. Yeah. So how do we do that? So there are formulas normally we use. 柴胡疏肝散, that's for basically the liver qi stagnation formula. Emotions, if you have 20 stagnation, 越居丸, right? 6 stagnation formula, so you can use that one. So if there's a blood stagnation is predominant with a little bit of liver, so we use the 血府煮鱼汤. Yeah, that's another formula. And people, this one is I also use a lot, is for the post concussion period. They start having trouble with headaches and insomnia, and so this is the one. Yeah, you can also use 二陈汤 or 温胆汤 if their constitution is phlegm constitution, right? Yeah, so that get rid of phlegm, reduce inflammation. Yeah, your immunity will be better. And 保和丸 and 仓附导痰汤. So 保和丸, the food stagnation. So don't underestimate this formula. A lot of times, what happens is basically, it's a gut issue. Yeah, it's the congestion. Yeah, the food cannot be fully digested and cannot be absorbed. So they need a little bit of push. So 保和丸is the one. Yeah, to increase the natural digestive enzymes. So that's pretty much the one. Yeah, 黄连解毒汤 or 双黄连. Yeah, if there's too much of toxin. Yeah, we're talking about the inflammation going on. So we mentioned earlier, the immune system has a close tie with the Sanjia burner. So all the formulas from 少阳病, so that can help to strengthen or can regulate the immune system. So there's 小柴胡汤, 柴胡桂枝汤, 大柴胡汤, and so that all in that category. And if you have so many excess exterior, interior, the upper, middle, lower. So we use a formula called the 防风通圣散. Yeah. So that's like flushing. This is literally to promote sweat, to promote urination, to promote the bowel movement. And so upper, middle, lower, in and out, this is flushing. Yeah. So that for prevention, for some people, this is better than a trackless, have excess type of constitution. And so on the other side of 防风通圣散, yeah, there's a formula called the 五积散, 5 stagnation. Yeah. And so there is a lot of the people say, oh, they have excess, but they have loose stool diarrhea. Kind of like when you have a cold accumulation, that's qi stagnation, blood and yin and yang. So what we use, 五积散, another one. And so the one I call that cure all for all digestive issues, called 火香正气散. Yeah, this one also this time is like recommended, yeah, for this group, the COVID-19 patient. Yeah, the initial symptom is a GI issue, nausea, vomiting, abdominal pain, diarrhea, and they don't have the typical lung issues. And so 藿香正气散 is the one that recommended for that purpose. So the treatment strategy for patients with the infection, that have been talked a lot. So basically showing this is a multiple organ, multiple level involvement. Yeah, so that brain, eyes, nose, lungs, liver, kidneys, and intestines all can be affected. So that's actually back to the concept from very beginning. Yeah, it's a 少阳病 issue, it's a 三焦 issue, right? And here's the symptom wise. Yeah, so there's a lot of symptoms can manifest. Yeah, so it's not so in conventional medicines it's harder to explain why. In Chinese medicine, the explanation is your body type. Yeah, so if you have a spleen stomach deficiency type, you show more GI issues. If you have a lung weakness, you probably show lung problems. If your heart, kidney not in good shape, that's probably where the target. And so here is the important to treating the viral infection. It's all about the pattern recognition and the symptoms to identify what stage of the pathogens are. Yeah. So that's actually according to Shang Han Lun. You're at the 太阳, at the 阳明, the 少阳. Yeah, you're all they go deeper. They're 少阴, 厥阴, and 太阴 now. And also this time around, don't forget, the best, the beauty of Chinese medicine is what? The individualized and the personalized approach. So when you treat something, it's not like, even though there's a lot of formulas we recommend, oh, this is the same type of a virus. Yeah, if possible, you still treat patient individually. Yeah, so you come up with the personalized approach. That always is the best, right? And so this time, and also personally, I prefer the combination of Shang Han Lun and the Wenbing, the worm disease. Yeah, and that actually Wenbing is a very is developed from Shang Han Lun. Yeah, but the combination actually give you much better way to evaluate, to assess the pattern, to diagnose the pattern, and to make it very easy, more comprehensive to treat it. And so there is Shao Yang Bing and the Jue Ying Bing that you see a lot, because there's a lot of central nerve issue problems. And so you hear, there's the gallbladder, the sanjiao, the liver, and it is a multiple organ system involvement. You heard on the news, there's this so-called like COVID, like toes, in kids. So from T-cell point of view, what is that? That is Jue Ying Bing. You have the blood stagnation and the toxin in the Jue Ying channel, so the extremities. So those are, can be a lingering. So it's not most time, not the first day. Can be like week 2 or week 3. After, so the main invasion of the virus. They attacking those. And why, people ask us like, why kids? Why those? Because their central nervous system is not fully developed yet. So compared to adults, why it's rare you see adults with the same reaction. That's the reason. Yeah. So that's how you look at it from the TCM perspective. So we focus on this is the early stage and the mild stage. So besides the recommendation from right now, I think the guidance is what, version number 7. Yeah, most of the people they have all that. This just from my limited experience in Los Angeles. I have about like 15 patients. So all I found out that actually 小柴胡汤人参败毒散 combination, 柴胡桂枝汤金防败毒散 combination, and or sometimes combine in combination with 藿香正气散、普济消毒饮 or 防风腾升散. That's pretty much enough to cover it. Yeah. And we have to talk about the geographic factors, like in New York, which is very similar to climate-wise, very similar to the epicenter in China, like in Wuhan. So they have what they call cold toxin epidemic. And in Florida, the weather is very much like in Guangzhou, in Canton province. So that's probably more like damp heat type of epidemics. Yeah. But like in Los Angeles, greater Los Angeles, what we have, like our climate is a little bit warm compared to the rest of the country and a little drier. So we don't see the typical. We have more like pretty much like a wind epidemic. Yeah. So that's why this may not be exact, accurate to your city, your practice. But this is pretty much the idea is, and according to the geographic climate change factors, you have to put those into consideration to recommend. And so this is the formula, the moderate stage, 清肺排毒汤. Yeah, this is the one that have been used the most, studied the most, and with the best results so far. And you look at it's a Shang Han Lun, all Shang Han Lun formulas, 小柴胡汤 plus 麻杏石甘汤 plus 射干麻黄汤 五苓散. I only have one patient who really needs this, who is actually a cancer. Elderly, 74, 75, and so she had 2 different cancers, just recovered from stomach cancer from last year, and she had a viral infection, Epstein-Barr, for over 30 years, and so she is like almost, went to the ICU. We used this one, for that patient, and so 2 days, symptoms pretty much recovered, and so she's fine. She didn't even she didn't need to go to the ER, the ICU, and so her friends was joking, okay, if she can survive, so can we? She has 2 different cancers. She has viral infection for 30 years. She's okay. So that is the power of Chinese herbs. If you use it right, this could happen to my patient, could happen to your patient too. So the post-infection strategy. So this is we're talking about from the very beginning. So this is probably what you'll see the most in the near future, right after. And the conventional medicine, they have this concept called the post-viral syndrome. So most times it's after infection, viral infection. So the fatigue is a major issue, and so that is very similar to chronic fatigue syndrome. So from there, but there's other, what is chronic fatigue syndrome, or the fatigue, the post-infectious, post-viral syndrome, and they have something that is very important. We call inflammation in the brain. So this is relatively is a new concept, but this is actually a very important concept. A lot of times when we talk about shen issue after infection, viral infection, bacteria, doesn't matter. So you have what you end up with dealing with is the shen disturbance actually caused by brain infection. And brain has a very, very unique anatomy, so we don't have time to get into it, but that's what they're talking about. And also, you could have the overall inflammation. So that basically is what? Toxin, lingering toxin. Yeah. So but you don't have enough qi, enough yang. You have too much of lingering toxin, and also the brain is inflamed. That's what happens. What happens is next there is what could cause the post-viral infection. Yeah, you name it. All those could be, including COVID-19. Yeah. So that's what caused it. And there's also the symptoms. Yeah, I want you to just take a look at the symptoms. Yeah, the post-viral syndrome: confusion, trouble concentrating, headaches, aches and pains in the muscles, stiff joints, sore throat, swollen lymph nodes. So you put that down, what that is, 少阳病 under Shang Han Lun. That's what we're talking about, like the half interior, half exterior. That's what it is. Yeah, this most of symptoms that show this. So what do we need to do? 少阳病 and 太阳病, 少阳病 and 少阴病, 小柴胡汤, 柴胡桂枝汤, 黄连阿胶汤. So those are, you have much room, to play with. Yeah, because that's pretty much what this is a typical case of post-viral syndrome. That's what you do it, how you do it. There's another intensive care syndrome. Yeah, so this is the people come out of some ICUs, and a lot of them actually have this shen problem. Yeah, that is PTSD, and also some of patients they have pretty much like the near-death experience. Yeah, and so with this group, yeah, what do we do? 柴胡加龙骨牡蛎汤, which is also from 少阳病, right? 桂枝加龙骨牡蛎汤 to regulate the central nervous system. 甘麦大枣汤, I give the term called the crazy lady formula. When you have a lot of shen, nerve irritation, a lot of issues, so you may have a chance to use this. So with COVID, so this is pretty much similar. This is the idea. Yeah, it's a multiple organ, and there's still unknown questions, and there's more questions than answers. Yeah, it's pretty much So, but according to TCM and the integrative medicine model, you see something, you just based on that treat it. Yeah, so this is you need to get the pattern right and treat it, and so. The overall, the post-viral syndrome is pretty much falling into the category called 虚劳, deficiency of 脏腑 and the qi and the blood, the yin and the yang. Yeah, and so most times we see deficiency, but in TCM actually there's a level. There's deficiency, the mild, and called 虚, 损, 劳, and the 衰. So from deficiency of the 脏腑 organ tissue to impairment, so some of those deficiencies, the function decrease, become pretty much like a permanent, and to depletion. So this is like pretty much in the compensating phase, and eventually failure. The failure that we are familiar with, you have congestive heart failure, congestive lung failure, liver failure, and kidney failure. So just give you the idea, in TCM, we also have a corresponding level of deficiency. So each deficiency, that's like, we need to identify that part. So we cannot just use one thing to treat everything. No, we cannot do that. We have to figure it out. So what is what? And so there's if there's a qi deficiency, depends on if lung, if heart, if spleen, if kidney. So accordingly, you have a different way, right? Blood deficiency, if it's a heart, if it's spleen, if it's a liver. So that's another way. And if yin deficiency, we mentioned some of the earlier, the lung, and with the lung, the sha shen mai men dong tang. This one you need to pay attention if you haven't used this one before. This is a very good formula for lung qi and yin deficiency. So the qi deficiency part is to strengthen the lung function, right? The yin deficiency is to help the lining to regenerate. So we're talking about when we have a dry cough, just like a shortness of breath, or tightness. This is a very good one. If you're not familiar with, this is why you should pay attention. So yang deficiency, And with the lung, this formula, ganjiang tang, is from Golden Cabinet. It's a classic formula to treat the lung yang deficiency. We don't get into the details, this is, but the lung yang deficiency is a very common pattern, actually, that there's a spleen, there's a kidney, Zhengwu Tang, we mentioned, we need to have that. So the last part, how to use the antiviral. So the difference between conventional medicine and TCM, in conventional medicine, they try to find the one that works directly to kill virus. So virus is have a life cycle. And in Chinese medicine, it's more about not just how fast you can kill the virus, if you can change the microenvironment. That's what we're talking about. Like a detox is when the virus is causing inflammation. If you reduce that inflammation, and you can change the pH, locally, right? And you can work from like how to basically interrupt the communication between the virus. So that's actually the approach. So don't just focus on with the strongest antiviral herb. A lot of times you don't need that. Because there's always two sides of the coin. You can go full force to the virus, or you can go the other side to make that environment is not friendly for virus friendly, so you can still do it that way. Okay, I think that's where we can have some questions. Jeff and Melissa.
Alrighty, let's get Melissa up here. Just bear with me 1 second. So we're actually going to be joined today on stage by Melissa Tsai, who is a former student of Dr. Wen. So she's going to do the questions and answers, and I'm just going to sit here and relax while she does that. So let's just get her up here, and here's Melissa. All right, looks like we have some questions.
Okay, great. So the first question that we actually don't have that many, is would you use huangqi and yuping fangfeng as prevention and first-line defense?
Yes. But remember, we talk about when you have the immune deficiency. So that's why mostly like elderly, or you already have some chronic illness, you do have that Wei qi deficiency to begin with. So you can, you can use that. But if you have mostly toxin, heat, a lot of fire, stay away from huangqi. And with the huangqi, we use the analogy. It's like the huangqi type. Huangqi type means pale and puffy. So basically, it's like easily to sweat and easily getting tired, and so they tend to return fluid, return water. So those are the huangqi type. So you probably, even you don't have any obvious conditions, you can use the huangqi for the first line of defense. Yuping first and huangqi.
All right. The next question is, what is the treatment principle for Shaoyang pattern?
For Shaoyang pattern, basically, in TCM, the Shang Han Lun like a theory is, Shaoyang is you have your, because we're talking about the immune system is pretty much like a mimic of the the lymph system and all that is involved the Shaoyang. So we say, okay, half exterior, half interior. So it's like your righteous qi and the evil qi are fighting. Nobody wins. So like right in that middle. So the term we use is like to release Shaoyang. Is basically is what you get rid of the pathogen, you boost the immune, the righteous qi a little bit. So that's why all the concept, anything like harmonizing, all the approach like harmonizing. That is what we do.
Would you include Diding, Qing, Huo Pian as part of the antiviral formula?
Which one we talking about? The what?
They're just asking if you would include, I guess, that formula in the antiviral formulas. It's Diding, Qing, Huo Pian.
吉林清火片 in combination or in combination with or just for preventive?
I think just as an antiviral formula.
And anti-formula, you can use it, for normally for prevention, we use like a half dose or even less, 1/3 or 1/4, because what you want, when you use those antiviral, like for example, like the 莲花清瘟营 they recommended, and you don't use the full dose for prevention. You use a small amount to stimulate your own immune response. Yeah, so you can use that. Yeah, but basically, the pattern differentiation and the constitution is the more important question.
All right. What about dosages when the person can't digest the herbs?
If you cannot digest the herbs, most times they have a GI issue, so you probably better take care of GI issues first. But if the herbs are too strong, sometimes we add with some like the food stagnation dissolving herbs. You can use 保和丸, yeah, like half dose, yeah, 1/3 dose of 保和丸 with the formula recommended. You can do it that way.
All right, the next question is, are there any modern formulas being created to treat COVID?
Modern formula is, there's a couple besides the one I listed here, 清肺排毒汤, that is the one, the main one, yeah. But the doctors from Guangzhou, they have one for the damp heat type of epidemic, which is like a combination of classic and some modern. Yeah, there's one formula we listed here called 达元饮. You can see it. Yeah, the second to the last 达元饮. So that is a classic formula for epidemics. Yeah. So that there are some other formulas recommended. They do have the combo. Yeah.
All right. Many call using 感冒灵 at first sign of virus. What are your thoughts?
You can, yeah. If your body responds to 感冒灵, better, yeah. Because people always say like, okay, use 感冒灵. Sometimes some people use 银翘散, yeah. Like, you hear it. Oh, this time 银翘散 seems like there's no room. No. We have patients also take 银翘散 with 小柴胡糖. Yeah, they're fine. They're fine. Yeah. So it's not a problem, and it's like if you have like a stronger constitution, 感冒灵、银翘散, like even 黄连解毒汤, yeah, we mentioned, yeah, in the lecture, they all can be used, as preventive treatment.
All right, so do you think this virus causes long-term lasting health issues more than other known viruses? And if so, can we address them with herbs?
Frankly, nobody knows. But from what we have, I have read, there's like one study. Actually, I think I read it yesterday from Germany. That did the autopsy. So from the autopsy, you pretty much can tell like basically how extensive the damages are. The good news is from what they have about like 15, I think, all of the autopsy, and not as severe in terms of like the heart damage, the liver damage, the brain damage. Yeah, because they can pretty much do the culture. They can still see if they have the viruses in the lung, yes, but not much in the other the vital organ in the system. So, but the thing is, like, if you have a pre-existing condition, yeah, that the chances to have a long-term damage is for sure is higher than the other group. Yeah. This time, from all the study, right? If you have a heart problem to begin with, and not just that, diabetes or pre-diabetes, you have those issues, you need to be careful.
All right. The next question is, can a patient post-infection use 沙参麦门冬 for wheezing, especially in the night with heavy sensation in the chest, but no coughing or sputum? She's also having fatigue and irregular digestion post-virus.
Yes, that sounds like just a lung, qi, and yin deficiency case. Yeah, you can use Shashan. And if it's working, it shouldn't take long. In a couple of days, if nothing changed, you just play with the dosage. Yeah, you can use a little bit more. Because normally I use the TSM Zone brand, 3 packs twice a day, like grams twice a day, 12 grams. But sometimes up to like double it. Yeah, so 6 packs, 12 grams, 2 times a day. Yeah, so you see the big difference. Yeah. So if it's the pattern is right, you tried it. If it's not working, it's a dosage. So you need to play with the dosage a little bit.
All right. The next question is, I heard you mention the formula Zhongwutang, your favorite one with the function for hypothyroidism. Mm-hmm. May you please talk more about the pattern and when I consider this formula?
Okay, Zhongwutang pattern is what we call yang deficiency water retention. So that, people most times think that water retention is edema. Not necessarily. Just like return water, you gain like water weight. Yeah, and you're fatigued, tired, you're very cold. That's pretty much it. Yeah. I also use the Zhongwutang. The recent couple cases is like after eye surgery. They have they just feel like there's like a water, like a wheel, like a water, like a waterfall. Yeah, and Zhongwutang take care of it. So that's kind of like one of the areas people always think, oh, when you use Zhongwutang, you have to have edema. No, yeah, water retention could be the kidney channel, could be anywhere. And you have cold. Yeah, that's pretty much it. Yeah.
Right. So the next question is, what time frame, how long would you use an appropriate herbal formula for prevention? If this pandemic lasts into next year, what schedule would make sense for people to use herbs?
Well, hopefully it won't be like that, right? Yeah, we're going to use herbs forever, for life. So normally the way is like you take turns, right? You take the tonics, for a week or two. You take a break, like a week or two, and then you get like kind of like rounds. Let the body to adjust. They produce a little bit more extra natural killer cells, extra the white blood cells and all that, lymph cells. Let the body to adjust. So this will be a better way. Not all the time, so you don't need to do that.
All right, and this question is, what is your preferred brand of herbs if you aren't using raw herbs? And do you have any tips for primary pain-based acupuncturists to transition into internal medicine? So the two I use pretty much the most is the one is the TSM Zone brand, the other is the Yifang brand. Yeah, so they pretty much have everything. Yeah, there's quite a few at the back east, and personally I know them. They're good, but personally I just never had the chance, to use much. And every practitioner treating pain, that's a given. This is not. Yeah, you can do way more than just treating pain, and there's a way to. Basically, just extend your practice. Yeah, internal medicine is a very good way to go. Yeah, and we have so by far we have like quite serious TSM oncology, infertility, and we finished the series not long ago. Yeah, the Shang Han Lun Shaoyangbing series. Yeah, so we're planning to do a little bit more for Shang Han Lun, because if you want to be a great TSM practitioner, you cannot leave Shang Han Lun off. Period. Yeah, there's no exception. No exception. All right, the next question is, as symptoms change, how quickly do we need to get the next appropriate formula to the patient?
So in general, the rule is like a couple days. Like this, 2 days, 3 days. If nothing changed, you need to change your treatment plan, different formula. And so, because like if it's a chronic illness, they have had it for years, a couple of months, that's reasonable. But like this epidemic type, there's always, because changes can be so quick, so fast. So day or two, then you need to see improvement. If it's not, you have to change your treatment.
All right. So this is any specific recommendations for pediatric prevention, also for nursing mothers to protect newborns?
There's a way, right? We always treat, actually, instead of treat infants, we treat the mother, right? Yeah, because that is, especially they're nursing, so you get the protection from the milk. So if they're still nursing, and the tonics, the general tonics we normally recommend, like 十全大补汤. Yeah, 十全大补汤 is a good one to, generally speaking, to enhance the immune system, because that covers both the T cell system, the B cell system, as well as a little bit more like adrenal support. Yeah, the 肉桂 and astragalus. So you can, and that also there's a side benefit from taking that, that'll produce more milk. So you can, if the mother try 十全大补汤, that is the one they can try. Yeah, you don't need to take a full dose, half dose, once a day. Yeah. And better quality of milk, better protection.
All right, and this will be the last question. Does a virus typically transform into a lingering pathogenic factor if not fully resolved?
From what I have learned, not much. Yeah, because there is, you hear it from the news, they had it, they had the COVID-19, and then they tested positive again. Everybody's worried. But from the research show right now, even you're tested positive after you recover, and they don't have much, or at least they don't have much of the same like strength to spread on to other people. Yeah, so this is the study showing. And I have, personally, the funny thing is like I have one patient right now. She had it. She had it for 3 weeks. She recovered, and then she tested positive. So I give her one set. We just the one we talk about, the 小柴胡汤 and 人参败毒散. I haven't heard back from her yet. It's because I want to see if that will actually turn the PCR test into negative. Yeah. So hopefully I'll hear from her soon, so I can report back to you guys about that.
All right, that's all the questions.
Okay, that's
yep.
Thank you, everybody. Thank you.
Thank you, Dr. Wen. Thank you, L.A.C, for putting this together for us.
Well, actually, I would like to thank Melissa, because Melissa is the one that brought this, wonderful webinar to our attention. So she reached out to us and said that Dr. Wen had great content and wanted to share it. Dr. Wen, thank you so much for showing up tonight. Every person here is so grateful for your information. It was wonderful. And again, thank you, Melissa, for setting this up for us. I want to thank everyone for showing up today. We have our second webinar of the day, and a lot of you have actually been there for both of them. So thank you for spending a Friday, before a long weekend with us. I hope you all have a wonderful weekend. On Tuesday, we will be hosting one more webinar, which will be 7:30 p.m. And it will be for best practices for reopening TCM clinics during COVID-19 outbreak. I just put a registration link in the chat field. Have a wonderful evening, and we will see you next week. Take care.
Thank you.
Thank you.
Yeah, hopefully we can see you guys soon.
Thanks, guys.